Welcome back. The Zimbabwe Nurses Association has announced that they are withdrawing their services with immediate effect. Dr. Emmanuel Masosota is the Secretary General of the Zimbabwe Hospital Doctors Association. He now joins us now on the line from Harare in Zimbabwe. Dr. Masosota, very good evening to you. Thanks for joining us. Welcome to the Globe.
Hello, how are you?
Great, how are you? It's good to have you with us, Dr. Masosota. First of all, do describe for us what withdrawing your services means. Is this a sit-in strike? Is it a picket? Or is it simply an en masse resignation from the government service?
No, it's not an industrial action, but we're just saying for our safety, we're just backing from the hospitals till we get personal protective equipment, and some of the measures that we asked for have been implemented.
So basically you are staying away until all your concerns are addressed?
Yes.
Well, we've seen Chinese billionaire Mr. Jack Ma donating about 200,000 test kits and 100,000 face masks, and as well as 10,000 health suits for health workers. And the Chinese government is currently building an ICU unit at the Wilkins Hospital, for critical patients in isolation. Is this not enough, perhaps, to persuade you to stay on?
Yeah, we understand every effort that is being done, but we've been writing to the relevant authorities for the past 2 weeks. By then, we didn't have any confirmed case yet. But then, for now, each day counts. You're in a hospital, you don't have protective equipment, each day counts. You don't know when you're going to meet a positive case. You don't know when you get exposed. So that's why we're saying it's a matter of urgency. We can just get maybe some protective equipment today, and then we wait till they distribute those other donations in the hospital as we work.
So in essence, the donation is meaningless and is not enough to persuade you to stay on and execute a public mandate?
No, we are not saying it's not enough, but we are saying for the meantime, maybe for the 1 or 2 days that we're going to work, we still need safety. So as they are running around trying to bring things around, we are saying we can't go into the hospital.
So, Dr. Masosota, what is it that doctors need specifically?
Okay, so personal protective equipment, it's not just one thing. So it compromises of gloves, it compromises of aprons, gowns, compromises of goggles, and some face shields, and also some overall. So these ones, they're graded according to the exposure you will get. So for someone maybe who's manning a general ward where there is no a case, we just expect maybe that person to just walk around with a face mask and maybe goggles and gloves. And for someone who's manning a casualty department where some of these cases may come up, we also need that person to move around wearing an apron, gloves, a face mask, and goggles. But then these ones were not being given in our hospitals. So we tried to contact the minister, but he was quite busy a few weeks ago. So he said that we should arrange with our clinical directors, which we did. But then for the 4 central hospitals, only one hospital seems to be having a plan that's working for their healthcare workers.
Well, President Emmerson Mnangagwa did concede that he is aware of these concerns that you are raising, and he did acknowledge that doctors are doing a great great job and delivering services at a great personal risk. And in that end, he has since ordered the release of additional funding towards the procurement of more protective equipment for doctors and nurses to use. So, what's the latest with regards to that?
I didn't get it.
Well, President Mnangagwa said that he has ordered the procurement of further protective clothing and equipment for doctors and nurses. So do we know at all how far that has gone?
We are just medical persons. We don't know much about procurement. When these things come in the hospital, we are not even sure. We just see when the things are there that now this is not available.
And for years,
so
critics...
procurement, I think we also have to check with the clinical directors.
Okay, and for years, critics have, have suggested that Zimbabwean government has neglected the country's health sector. Do you harbor any fears that Zimbabwe could become yet another epicenter of coronavirus as a result of this?
I think it also has to do with prevention also. So some of the policies are made by government. So if there are going to be cases which are still coming in and then we don't also address issues to do with local transmission, I think that is the other issue which we have to, we need to address before we say it could be another epicenter of the coronavirus. Because we know that the hospitals, what they do is much of supportive rather than the preventative measures.
And the fact that President Mnangagwa has partially closed some of Zimbabwe's borders, do you think that's enough? Do you think he should have totally shut down the country, from the rest of the continent? Yeah,
we also think that a total lockdown would be also advisable, given that that's what many other countries are also doing, and the countries that are also the countries that are succeeding in combating this pandemic are doing. So we need to also follow suit. But that's the government policies. We as medical personnel, we can't do that.
Well, Dr. Masosota, I would imagine critics would go to town, criticizing you, criticizing the doctors and the nurses for having taken such drastic measures at such critical times that the country is facing, that the world is facing, because coronavirus is not just a Zimbabwean crisis. It is, it is a crisis of enormous proportions. It is a crisis facing the whole world. Do you not think that you'll be subjected to such criticism as you are being opportunistic, the fact that you are using this coronavirus to fight your own battles?
Okay, if you could also see one of our letters that we wrote to our clinical directors, money was a list of the things we required. But what we required was much of safety, and then a risk allowance for the healthcare workers that will be taking care of the patients during this pandemic.
That's exactly the basis of my question, Dr. Masosota, that is this not perhaps opportunistic, that you're using a crisis to further your own personal means?
No, that's why I'm saying money is the list of what we need. What we need first is protective wear, and we also need running water in these hospitals. Water is a countrywide problem, given that our countries have not been delivering that much. So we need measures that helps us prevent the spread of this coronavirus. And then if you also follow where outbreaks happen, they also get allowances even in the countries where where there was an Ebola outbreak. People also got risk allowances.
Dr. Masosota, the Zimbabwe Nurses Association, and the Secretary General of the Zimbabwe Hospital Doctors Association, thank you so much for your time. Much appreciated.
Okay, thank you.